Thanks for staying with us. Researchers say cases of diabetes worldwide have doubled from 7 to 14% since 1990. That includes type 1 and 2 of the disease. And today is the commemoration of World Diabetes Day. We speak to the Healthy Living Alliance CEO, Nzama Mbalati, who joins us this evening. Good evening to you, and thank you so much for your time. Reading your statement earlier on, you say that it is no coincidence that we are seeing the growing epidemic of diabetes in South Africa. Let's just start with that statement.
Yeah, certainly. Thank you very much for the opportunity to speak to you. If we look at the scourge of diabetes and how it has been growing, it's not a coincidence, and we can learn also from HIV. We have seen how the scourge of the diabetes has been growing. We feel like there's not been a proper response in terms of a collective, society intervention, from policy intervention to the kind of food that we're eating, to the food environment that we live in, to actually even people being able to have body activity. At some point, recently I went to Brazil, and Brazil is a very active body activity country, right? Because there are also issues of safety. So we need to look at diabetes similar to the way we looked at it into HIV, as a crisis, as an emergency, as something that actually needs, a bold and a rapid response now.
And when it comes to a bold and a rapid response, for example, you think about the fact that some of the areas that we talk about have, limited to no water supply. It speaks to things at a practical level like that, because some of the people may opt to not buy a bottle of water in order to be able to consume that, but may opt for fizzy drinks, which speaks to the intensity that we need to begin to educate people on.
Right, and that's a very critical question and comment, because diabetes is a socio-economic issue. If you look at the issue you spoke about, I also come from Limpopo. In my household, where I come from, my mother still buys water. So communities around, will opt for, a cheap sugary drink or a cheap energy drink that is 8 rand. If they are thinking about they need to buy, a 25 liter of water in order to drink, to cook, and to wash. So you cannot isolate diabetes from other socioeconomic issues. Issues of poverty, right? If we're telling people to eat healthy, can people afford, healthy food? Can people have access to healthy food? So just the same way as we tackle HIV, we need very bold and rapid response in terms of policy intervention, because one of the things I've been saying to my colleagues that diabetes is increasing poverty. By this, I mean, if you're diabetic, right, there's a cost to diabetes in terms of you need to purchase your medicine. If you're getting your medicine free in clinic, you have a script of the food you must eat. So in this person who's diabetic no longer eat the food that other people eat in the household, because he has been told now it's already diabetes, but it's already a bit late. So I think we need bold action in terms of screening, in terms of prevention, in terms of management of diabetes. I have recently had friends and family members who were severely and gravely ill when they were diagnosed with diabetes. So that is a worrying concern, because it's a silent killer.
And I'm going to get to the havoc that it wreaks to one's body in just a moment. But are you, I'm keen to hear your thoughts on this one. The Health Promotions Levy, has it worked at all?
Yeah. So the Health Promotion Levy, these are evidence-based policies that have been actually verified in other countries by also the World Health bodies, including the World Health Organization. In South Africa, we have seen a reduction in consumption. And I want to always put similarities to struggle, similar to HIV, because the private sector, the sugar industry, has been in loggerheads to ask for the Health Promotion Levy not to be increased, actually not to be implemented, since even when it was implemented in 2018. The biggest problem is when we're dealing with issues, and even if you can include tobacco and other things, is that when you have a private sector that doesn't want to transform, it will tell you something doesn't work, or maybe even if it's working, to say it has adverse effects. The problem is that if we don't take bold action, such as interventions such as the Health Promotion Levy, making sure that there's front of pack warning labels in food that is unhealthy as a way of raising awareness, because reaching 1 person at the time to educate them. We know it's difficult and behavioral change. So there are other interventions that we can have. We can make sure that this food is not marketed vigorously, it's not made sexy. We can make sure that the school food environment doesn't have unhealthy food. We are talking about children dying, which is a serious issue, which is covered by the media because it's costing life, because it's well reported. It's a significant number of people children dying in our faces. But there are a lot of people who are dying of diabetes. Diabetes is said to be the second leading cause of death. And I think everyone in the family, it will be said it's natural death, but we know someone has lost a family member or a neighbor due to diabetes. And
as you say, it really is important for people to know what they are eating, especially when it comes to the labeling. But as we end off our conversation, there's another, issue here. Left untreated, diabetes can wreak havoc in a person's body. You think about several complications that are, linked to this one. Now, when we're looking at this particular aspect of the disease, have we even begun to understand what it can do to a person's body?
Yeah, that is the biggest problem, Sis Bongiwe, and I can take you a step back. Do we know how many people are living with diabetes or are even pre-diabetic? Because the surveillance of diabetes is a big problem in this country. So the data that we have is really outdated. It dates back to 2019 and years back. So we have a poor surveillance in terms of knowing even people living with diabetes currently. We know that it's 4.2, the known number of people living with diabetes. But like you have said, I have recently had family members and friends in the very recent moment, within these weeks, within these months, where someone felt dizzy, someone really felt gravely ill, and when they went to the hospital, their blood sugar level was too high to be able. So diabetes can wreak serious havoc in terms of it can actually even collapse. You can even collapse and die instantly if you are not screened, if you didn't know you are pre-diabetic or you have actually developed diabetes, because it can raise your blood pressure at the same time, and cause a serious havoc in your body in a way that someone can even collapse and someone can really fall gravely ill if it's not detected early.
Yeah, and as you say, surveillance needs to be strengthened. But thank you so much for talking to us. Appreciate it. And as we cast the spotlight on this important conversation, that was Healthy Living Alliance CEO Nzama Mbalati. On that note, that's where we leave it from the news desk. Oli is coming up next with sport. We'll see you again tomorrow. Good night.
Thank you, Bongiwe. Let's start things off.